Hello, everyone. This is Chadi Alraies from CVI 2022 in Denver, Colorado. I'm really privileged to have Sheila Sahni. She is one of the most pronounced cardiologists I have met since our fellowship. She's currently practicing, she's the director of Women's Health Program at Sheila Sahni Heart Center. Sheila, it's always nice to see you.
It's great to see you.
Yeah,
Thank you
it's
for
been
having me.
2 years, pandemic, we're off, and I still follow your achievements and what you have done. It's phenomenal work.
Thank you. You as well.
Thank you. So Sheila, we since 2017 we used to come here.
Yes.
And CVI is near and dear to us because we felt we grow with the program.
Right.
So tell us about your experience and why people should come here.
You know, it's absolutely true that since its inception in 2017, I think that the conference has really grown. And what they call themselves, the Operators Enclave, is so indicative of what the meaning and the mission statement of the course really is. But even from our early career, you can see that the investment of the faculty in really teaching, not only having hands-on training on site, but everything, all the discussions are case-based. And the moderation in the panels is real-life practicality of the cases that you're doing. Right. So when you're graduating and you're going into real practice, that is what you need. You need to know how to perform those cases, how to get, the uptake of those technologies in your institution, and how to do them safely.
Right, and what is up and coming as well,
right.
as indicated by the name innovation, what's
right.
up and coming and what you need to be familiar with.
Correct. They're always talking about the latest and the greatest while balancing the new data and letting us know what's coming ahead.
One of the most pronounced sessions, as you know, is the complication sessions and also the complex cases,
yes.
which is, I think, means Sheila.
Yes, that is my passion. And I think that's another thing about, the way that the course directors really align their faculty in areas of their expertise. I've been invited back multiple times to discuss high-risk coronary work, complications, as well as how to manage calcium. And there's no price for that discussion, regardless of how you practice, right? I'm in solo practice in New Jersey, not a major academic center, yet the value of how you practice in a community-based setting versus academics is really important, and that's what captures such a wide audience, and that's what fellows in early career need to hear about.
Absolutely. So I think one of the key things, as you alluded to, is the practical aspect that we see it now in practice. So, but the fellows, if they see it ahead of time,
right,
it's priceless.
Right, and I just came out of a great session on radiation safety. Couldn't be more important for fellows to be learning those techniques,
right.
From the inception of creating their habits.
And speaking of radiation safety, we spoke about it. I remember maybe 3-4 years ago
yes.
about why women not going into cardiology with the fear of radiation, but
right.
now it's becoming more awareness and how
right.
to protect yourself.
And the webinar that I completed for Women as One on radiation safety practices has been really helpful to create global awareness.
Yeah. So Sheila, let's shift gear a little bit to the practice and what is your advice for people graduating and going to practice, and what they should do, or what are the kind of the toolkit they should be familiar with when they go to practice?
It's really important to recognize that when you're in fellowship, you're in such a protected environment, and you shouldn't graduate with, like with a bullheaded personality that you're going to do everything. You really need to weigh out the spirit of the cath lab and find out who are the big players and who can you align yourself with. So when you are going to be doing that first complex case, you can count on somebody. Hopefully that's within your practice, but sometimes it doesn't always have to be somebody who you're working with or your direct partner. It can be anybody who's in the lab with you that day if you can align with them. And you're always better off involving them in the discussion before you start than having to call them to bail you out later.
Yeah.
And it's worth taking their opinions. It's also really important to know your staff, know where the equipment is. These are small steps to set you up for success.
Yeah. Sheila, we'll move one more step, because you're an expert in women's health in cardiology and cardiac care. You've been pioneer in the SkyWin. You are Women as One, and you are a director of your program as well. What are the things that we should be aware of for women with heart disease, and what are the things we should screen for, and how to treat them, and are they different?
Regarding the use of we're at an interventional meeting, and one thing we need to know is that devices work in women. And too often women are not getting offered interventional therapies because they're perceived as being too frail. You know, we know atherectomy works. In fact, IVL is great for the use in women, but we know radial access is better for women as well. So it's really important that we don't look at women as frail entities. And obviously, we always need to remember that heart disease is the #1 killer for women, and we cannot let their presentation in the emergency rooms delay their presentation to the cath lab. And lastly, you know, there was a great session on diagnosing microvascular disease. 51% of INOCA, right, is actually diagnosed as microvascular disease, and women are a big subset of that population. And they present more with NSTEMI, have open arteries, and are sent off saying you had no event, which isn't true. We need further testing for those women presenting with open arteries but chest pain syndromes.
Correct, because I think they said, oh, you have coronary artery clean, you can go home, but yet mortality is no different than people. Yeah. Well, Sheila, final message, why people should come to CVI?
Oh my goodness, because this meeting is like no other. The technical experience that you're going to get and the technical learning that you're going to get, I really have to say, is unmatched in the interventional world. It's a small meeting, so it's efficient. It's really easy to get in here, and it's small. You're going to meet the faculty. You are going to network. Almost everybody leaves their email and their phone number at the end of their presentation. And this is where, you know, if you're really trying to up your game or you're trying to understand how to do your cases better, this is one of the best interventional educational forums for that. Should not be missed, and all fellows should attend and take advantage of the grants.
Thank you so much, Dr. Sahni, for your time. And you got the message loud and clear why you should come to CVI. Please watch this video and others on CVI YouTube channel. This is Chadi Alraies from Denver, Colorado. Sheila, thank you so much.
Thank you.